All right, welcome everybody. I'm Jess Stanko. I'm going to go ahead and turn it over to Rebecca to kick things off this morning.
All right, good morning, everyone. Thank you for joining us. We're excited to be here today with you. And welcome to South Dakota Project First Line Office Hours. My name is Rebecca Syme. I'm an RN. I have a background in surgical services, both in the OR and SPD, as well as dialysis, the emergency department, and long-term care. Jess and I both work for the South Dakota Foundation for Medical Care. I'll give Jess a moment to introduce herself.
Good morning, everyone. My name is Jess Stanko. My background is healthcare administration. I'm also certified for infection prevention in the long-term care, and I am a registered respiratory therapist.
Thank you. Jess and I, like I said, work for the South Dakota Foundation for Medical Care, but we are brought to you here today through South Dakota Project First Line. South Dakota Project First Line, excuse me, is a collaborative initiative between the CDC and the Department of Health. It was created kind of at the time of COVID to help bring infection prevention, education, and training to frontline healthcare workers. And that's what we are continuing to do. We also have a guest with us in our office hours now, and that is Sherry Fast. Sherry, I'll let you take a moment to introduce yourself and talk about what you do.
So thank you for having me. I'm Sherry Fast. I'm a nurse. I have my certification in infection control and also in the long-term care setting. And what my primary role is to help reduce healthcare associated infections in healthcare facilities throughout South Dakota right now. And so as you'll see later in the presentation, you'll see some of the things that we're finding as we go out into facilities and help in this work. So.
All right, thank you. Sherry will kind of jump back in a little later and go over the areas in which you just discussed a little more deeper extent. So the South Dakota Project FirstLine.org website contains a ton of resources for you to look up when you have time, some things that can help you. We have all of the posters there, as well as other interactive games, educational tools, just things that you can learn from and even put to use for training in your facilities. The recognizing risks in healthcare, this video has a lot of good stuff in it too. So if you want to just take a moment, the link is there. You can check that out on your own time. It's a great resource as well. So with that, we're going to go right into our objective for today, which is germs can live on dry surfaces, and where is the risk? So if you think about every day, we touch all kinds of surfaces. We do, the patients do, the residents do, and being mindful of those. We know that germs can live on the body, in the air, and in stool, and they can live for a long time. The same is true on any dry surface. We talk a lot about those high touch surfaces. Those are the items that are in the patient or the resident's common areas that they touch often. Things like bed rails, door handles, light switches, and being mindful that we need to clean and disinfect those high touch surface areas often to combat the pathogens that are living on them. Our hands as well. Our hands are considered a dry surface, and we move them from task to task and person to person throughout the day. So ensuring that we're performing hand hygiene. The preferred method is the use of that alcohol-based hand sanitizer, and then washing with soap and water. Washing regularly and consistently or using that alcohol-based hand sanitizer is the #1 thing that we can do. And then the devices that we use every day, whether that be the pulse oximeter or a blood pressure cuff or just any number of things, making sure that we're cleaning and disinfecting those items between one point of use and another. To talk about some specific germs that live on surfaces is C. diff. That's one of those where C. diff requires the use of soap and water to clean your hands versus that alcohol-based hand sanitizer. So if you think about a patient or a resident that is currently having episodes of diarrhea, that definitely is something you want to be mindful of, is C. diff, and then knowing that you need to use soap and water to combat that. The norovirus, the Candida viruses, including the auris, the rotavirus, just some of many of the germs that could be living on the surfaces. So we think about the healthcare tasks involving dry surfaces. So kind of what we've been covering, anything we touch, any devices we use, the items we use to transport patients. Again, just the fact that germs are everywhere on all the surfaces and being mindful of combating them by cleaning and disinfecting and kind of keeping that at your forefront for sure. So the actions that we can do to reduce the risk, we've already kind of covered that. Cleaning, so the use of just like soap and water to remove the visible dirt, debris, and then disinfection after that to kill the germs that are living on the surface. Sterilization, that may or may not come into play in your area. Make sure that your sterilization processes are happening where they need to be and according to standards. And then hand hygiene, talking about that alcohol-based hand sanitizer, which we already did, or those times when you know you need to utilize soap and water for cleaning your hands. Also, the use of personal protective equipment. So making to use gloves and using gloves appropriately. So performing hand hygiene, donning a clean pair of gloves, performing the one specific task. Oftentimes we kind of see gloves going and doing multiple things. Well, then you're just spreading the germs. So perform one task with your gloves. Then when you're done with that one task, remove them and perform hand hygiene again. And then gowns or protective eyewear, whatever it is that you need to use for the situation. So that covers the Project First Line area. And again, there's the website, and we can reference that again at the end. But what I'll do now is turn it over to Sherry, and she can talk about her area today.
Okay, well, thank you again. Before I get started, I just want to give a shout out to all of our environmental service staff and technicians that are out there. And if you didn't know, this is an EVS week. And so make sure that you say thank you to your EVS staff and those that really go the extra mile. You know, they're the front lines, and that's what people see, and first impressions go a long way. So just reach out, say thank you to them. They're an important part of your team in healthcare. Okay, you can go to the next slide. Can you advance it, Rebecca?
1 second, I think sometimes there we go. Sorry.
Okay, that's fine. So as Rebecca said, germs live in a multitude of areas and places, and we know that hand hygiene is very important in reducing infections. And so what we're going to show you today are some of the things that we find when we go out into facilities and work with dry surfaces and helping educate staff on how to prevent healthcare associated infections from even occurring. We know that hand hygiene is critical to this, and a lot of facilities are doing audits and things like that. And everybody does great when they're being watched, but it's when they're not being watched and someone's sitting there with a clipboard that things aren't being done. When we go into facilities, we pretend that we're looking at other things and we watch missed hand opportunities, and we usually find many throughout facilities. We were at a facility yesterday and we counted out, I think 44 or 40 yesterday in a very short amount of time. And so things like that are very important. And yet when people return their audits to quality directors or infection control, they have, 90, 95% that they're doing everything they need to. Well, we know that that's not really happening. And so once you back off on your audits, infections or hand hygiene missed opportunities go up again. And it's not of anyone's fault. They just get busy doing their task, and they're so focused that we get busy and we forget. So I really believe that investing in hand hygiene can really, you can get a return on your investment if you really spend the time and focus on those. So we're going to show you some pictures. Like I said, these are some hand sanitizers that we've found in facilities. This one, obviously, sometimes we focus on the counter and everything around, but our dispensers have to be cleaned as well. How many hands are touching this? So don't neglect those surfaces such as the dispenser themselves. We find dispensers that are broken or empty. People can't use them if they're empty or broken. And so just a reminder, let your maintenance or whoever does your equipment, if those are broken, they need to be fixed, and make sure somebody is regularly checking them to make sure that they have product in them. Next slide.
Hey, I'm just going to jump in there. One thing to look at too when you are in your facility, go look at the availability of hand hygiene dispensers for your staff. We are finding in many places it's just not readily available for your staff. And if it's not there, you know they're not doing hand hygiene. They're not going to walk across the room to get sanitizer. So really go take a good look at that in your facility and how your hand hygiene dispenser or your alcohol-based hand sanitizer dispensers are spaced out.
Thanks, Jess.
Yeah.
A question I'm kind of thinking of, Sherry, and I'm gonna pick your brain a little on this one, is I think it's one of those things that we commonly see is when those audits are done, like you said, it's like, oh, 100%, good job. You know, is there what do you think is the mindset or the thought behind maybe that people think it's best that we have the audits be perfect when maybe they weren't necessarily? And then what is the benefit of making sure that you fill out those audits correctly and then learn and work from them?
Yeah, I think it definitely can be a quality improvement project. And I think that once you back off on those audits and things, that people tend to slack off again. If we teach our new nursing staff, our new healthcare providers, our EVS team, the proper ways and when to do hand hygiene right from the beginning, it will become just second nature and it won't be an issue. Yeah, I just think we can't stress it enough. So,
Thank you.
as you can see in this slide, we see when we're out in facilities, we see a lot of people in the hall with gloves on. Yeah, they think they're protected, but they go in and out of rooms, touch a variety of surfaces without changing their gloves or doing hand hygiene. So that's one thing that we really watch and we cue in on, and we try to educate on. You went in and out of this room, you touched the lift, you touched whatever it was, and we really need to do hand hygiene in those opportunities. Right there, I have an audit form. In the infection control risk assessment, the new ones that came out, there is an audit form for most anything, at least in the 10, 11 areas now, that you can just print off and you can use. So I encourage you to do that. Next slide. So some of the other things that we find when we go to facilities, we look at the environment overall because we know germs live in dry surfaces. So these are window seals that have gotten neglected, whether that be because we're short-staffed or whatever. These kind of things need to be addressed and taken care of. And that last picture is a handrail. Handrails are designed to be touched. We want people to use them to keep themselves safe from falling and things. But I did a little bit of background work, and there is a lot of bacteria found on handrails in healthcare facilities, both gram-negative and gram-positive. And so we really need, along with C. diff, so we also have those spores that can, lurk around. So we need to make sure that those high-touch surfaces are disinfected regularly. You can see that stainless steel one, although that's probably is preferred over like the wooden handrail, it still has to be cleaned regularly. And so I don't want those to get neglected. Actually, wooden handrails are actually on the way out because they harbor many more bacteria and germs. So if you can install the stainless steel or have the PVC, they're usually better for cleaning and disinfection purposes than the wood. So just think about that if you're able, or you're thinking about replacing handrails. go with that instead of wood. Next slide. So we also look at devices again. So we have nebulizer equipment, respiratory equipment, laying on patient beds, resident beds. We have the mask in the drawer or laying on top of the dresser there. So you can see there's a lot of stuff going on there, a lot of germs and potential germs there. So just make sure that you're checking and that you're following the most recent guidelines for cleaning and disinfection of your nebulizer. You're storing your things correctly. If you have a nebulizer, you'll want to use them, rinse them out with distilled water or sterile water, not tap water. Tap water is not recommended anymore. And you'll want to not dry them on a washcloth or by the bedside stand, but rinse them out like, with the sterile water and distilled water, and then put them in a plastic bag with holes so they can dry properly. If you have to lay them out, using a paper towel is probably better than using a washcloth. So next slide. So we also see things like this when we go into facilities. Yes, they've cleaned the bed, they've put the new linen on, and then they put the pillows on the floor. Probably not the best practice. We know the floor is probably one of the dirtiest areas in a resident or patient room. So just be mindful of that. When you do clean a mattress or a cart, if you're in a hospital setting, sometimes we want to turn that equipment over very quickly. Remember those surfaces and those pillows like that, they have to stay wet for the contact times of your product. So before you put your pillowcase on, before you put your sheets on, make sure that those surfaces stay wet for that desired contact time. Don't just immediately wipe them off and then put your pillowcase on. And don't put them on the floor, please. Next slide. We talk a lot and we spend a fair amount of time in laundry in healthcare settings. You can see this is a laundry cart that's been neglected. All the germs and bugs that happen there. Make sure your carts are on a cleaning schedule as well. Laundry should be bagged at the point of use and placed in hampers that are lined with leak-proof bags. We recommend lids if at all possible. Let's see, linen should never be shaken or placed on the floor. We see a lot of times the linen is put on the floor and then picked up and put into the hamper or the laundry bin. So just be mindful of that. I'm curious, and those on the call, if you'd put this in chat, when your laundry staff go collect the laundry from the different units in your facility, do they change their gloves or do they use the same gloves throughout their entire run? Just something we've seen it both ways. Just curious to know what facilities are really doing in that space. That last picture is a mattress overlay, and you can see the finish is really worn off on that. That's really considered a non-cleanable surface, and I would recommend getting rid of that. Anytime you have equipment that is worn like that, it can't be cleaned properly. So next slide.
The one answer in chat is at their facility, each department brings their dirty linens to laundry.
Oh, nice. Yeah, we just see a lot of things in the laundry on, from using the same. So they might have like a gown on and they're pushing these tubs throughout the facility and going in and out of bins and without liners, and then they rub against it and then they go to the next unit with the same on and not change. So we're just kind of trying to figure out what is best practice. Another question I have is, has anybody heard of a no rinse facility? If you have, I would love your insight on a no rinse facility, meaning your aides, nurses, if they have something soiled, they don't need to rinse it. They just put it in the laundry, and laundry puts it directly into the washing machine after they sort it. I'm just curious about that. That's something new that was presented to me last week. So, all right, next slide. Again, we're looking at equipment that's worn and torn, similar to the last picture. So when we talk about dry surfaces, we also think about transporting patients. So these wheelchairs, they're worn, they're cracked, that surface needs to be replaced. Think of how many patients are sitting in there. Again, with that walker, again, worn, difficult to clean once that finish comes off. So just be mindful of those things. Next slide. We also look at the kitchen. We find a lot of things in the kitchen. Make sure that the refrigerators are cleaned out. You can see this as a spill. It was there for a very long time. The dish soap up at the top was very corroded and had a lot of scum built up on it, same as the scrubber in that butter dish. Make sure that you're replacing them and you're not using them continually and never replacing them. I think those say all that we need to say about that. Next slide. We look at patient care and we look at items. So when you're doing treatments such as blood sugars, make sure you're using a barrier device or you clean the surface before you set your supplies down. Call lights on the floor. I've had this conversation with many people, and if you've listened to me talk before, call lights on the floor is a big thing for me. When I was actually working on the floor, did I do the same thing and call light would drop on the floor and pick it up and hand it to the patient without even thinking about it? If you have the ability to wipe that off or just, try to be mindful of those things, because that's what we do. We get busy and just forget. So next slide. Equipment. Again, we want to make sure that you're cleaning and disinfecting your machine. So this is a vital machine. You can see the bottom of that. Sometimes the tops are clean, but the bottoms get forgotten or neglected. Same as the baskets inside. A lot of things happen in those baskets. We've seen a lot of things in those little baskets. And then on the last picture, obviously make sure that our garbage and trash cans are clean. This one has stool on the side of it. Very unbecoming, very unsanitary, not a good practice to get into. I don't think we need to talk about that. Think about the C. diff, the germs that live in that stool, and how many people come in contact emptying that liner. And, I don't know this for sure, but I'm guessing that stool had been there a while. When I went in the room, the garbage was actually turned the other way. So it was almost as if somebody turned it and didn't want to clean it. So next slide. Next slide, Rebecca. There we go. So another thing we look at in devices is fans. Make sure that those are being cleaned on a regular basis. One interesting thing we find is many people say they don't allow fans in their facilities, but we find them almost everywhere and in many rooms. So make sure that those are being cleaned appropriately and on a routine basis. We certainly don't want people with respiratory infections or allergies to get sick because of dust particles that are blowing right into what they're trying to breathe. And then stained ceiling tiles, those are wet, mold can grow on those. Just walk through your facility and check those out. Those are pretty easy fixes. Next slide. Again, we look at equipment. How often are our ladders that our maintenance guys use? How often are they cleaned, replaced? This one particularly, they had a leak in their ceiling and right above that, which you can't see, and a lot of the ceiling tile dust was falling down below it. The floor was wet below it. So just be mindful of those. And then the carts that they take down the hall, they have a lot of stuff on them. And so just be mindful again of those processes. If you're going to take that cart down the hall, I would cover it with a sheet or something, just as good practice. Next slide. And we also find really good things too. We don't always just look at the negative. although that's tends to be what we focus on. We loved this little sign on the garbage, that little Oscar the Grouch in the garbage can. Make sure that signs are all laminated or put in protective plastic sleeves so they can be wiped off and cleaned. We see a lot of things in the kitchen where their condiments or their silverware is in containers like this one. Most of them are very dirty and grimy, and they have a lot of debris in them. So those need to be cleaned out. This one was spotless, and we commended that facility for that. Same as that sink. That sink was absolutely spotless, and they were in the middle of their preparing their lunch at that time. So they took a lot of pride in their kitchen, and we like to commend people for things like that. So next slide. This is us, I guess. I haven't seen this slide. This is us. So please contact us for anything that we can help you with. One thing we like to do is go in and help your facility reduce infections any way we can, and try to improve and be better. We do a lengthy report. It's all confidential, and it just stays with your facility. We don't share that report with anyone. So it's just a learning opportunity. I try to think that we're not scary, although people do run when they see us coming down the hall. But yeah, we'll take any questions if anybody has any.
You can put your questions in chat or come off a mute if you would like to ask any questions, or if you have any respiratory or infection control concerns, we're happy to talk about that at this time as well.
You can always email us too if you have specific questions. We're happy to help in whatever way we can. When we come in, a proactive iCard takes about 4.5 to 5 hours. We walk through the facility. We do take pictures because it helps bring things home into real time for your facility, and then we can either present to your entire staff, whoever you really choose to have attend that meeting. Sometimes we just do managers, sometimes we do EVS, sometimes we have a combination of people sitting in the training. So it's just really whatever you like, we can individualize.
Any other questions before we wrap up for today? If not, I just want to say that going forward, we will continue to show pictures of things we're finding in the facilities. Really what we hope you do with those pictures and the images we're sharing is go to your facility and take a good look. These are common things that we're finding throughout the state of South Dakota. So it's just an opportunity for you to be proactive and go and look at these areas in your facility and see if they need to be worked on, improved, or new processes implemented that really can get you to be proactive in your infection control throughout your processes at your healthcare facility. All right. Go ahead.
Sorry. Thank you, Sherry, and thank you, Jess, for chiming in with that. I have put the South Dakota Project First line back up here. Again, there's our website listed at the bottom, and there is the QR code that you can scan there. And another thing I'd like to say before we all sign off today is we're trying to continually evolve this process of office hours based on recommendations or areas that you guys maybe want to talk about. So by all means, contact us. Let us know if there's something you want to see, something you want to cover, any other ways that we could help you. We are, like Jess and Sherry said, more than happy to help in any way that we can. All right. With that, thank you everyone for joining us today. We appreciate you being here, and enjoy the rest of your day.
Bye.
Bye.
All right. Let's stop
I tried
recording.
to turn my video back on, but